Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes, and today we are going to execute a writing task, which is otherwise very simple, but there are few ifs and buts in this writing task, which can, make us think a lot. So again, I have always told that make OET writing very simple and don't write anything which you do not understand. I'm telling you again and again, if you write anything that is not supposed to be written, then you are in trouble. If by chance you miss any information, then you still might pass. अगर आप गलती से उसको कम लिख देते हो, एक लाइन छोड़ देते हो, तो पास होने के चांसेस रहते हैं. लेकिन अगर आप लाइन को गलत करते हो, तो पास होने के चांसेस कम हो जाते हैं. इसलिए जो भी लाइन आपको तंग कर रही है, प्लीज डू नॉट राइट दैट लाइन. टेकिंग यू फर्दर, हमेशा लेटर को लास्ट से स्टार्ट करते हैं. वी ऑलवेज स्टार्ट द लेटर फ्रॉम लास्ट. तो दिस इज अ लेटर टू द कम्युनिटी हेल्थ नर्स explaining the care required for Toby. The name by chance galat hai, so we have to write the letter to the community health nurse, and we need to explain the care required for Toby and Mrs. Philip. As you know, in the visit letter, today's visit is the purpose. In discharge letters, this is the purpose. So this is the discharge plan, that community nurse to monitor baby's development and weekly mother's health and post-operative activities with the breastfeeding techniques. So these are the three main components of this writing: baby's development, monitoring. Then the second component is health of mother's health. And third major component is helping her with the breastfeeding techniques. So please understand that this would be my topic today. So this is the main purpose, that I have to tell the community nurse to monitor baby's development, monitor mother health on weekly basis, and breastfeeding techniques. So this is the topic of the day. So when I see then I will go in the start. So purpose I already know. It is looking like a follow-up care, but now I would like to read the whole letter. So when I go to the first page, trying to know the patient, you are a nurse where Toby and his mother came for the treatment. Patient name Toby Philip. Mother's name is Maria Philip. So the baby took birth. He was delivered on 2019, 30th October. And if we check the date of today, the last date that has been given is 9th 11th. So that means if I consider this 30th October, if today is 9th 11, that is the last date. So the baby is almost 10 days old now. 10 days, because 31st October first day, and then plus 9, almost 10 days old. So Toby Philip is 10 days old. Mrs. Maria Philip. Father is Philip Gores, businessman. History: born on 30th October 2019 via emergency LSCS. Birth weight is 3.8 kg. And the APGAR score was 4 at the time of birth. So if I have to write this, so I will say at the time of birth. This is the best way of writing in the past. At the time of birth, baby's apostrophe S, baby's weight was 3.8 kgs. And AP, any word that you do not understand, that's it. In this writing, I do not understand the meaning of APGR. So I write it this way: APGR was 4. I try to write only that thing which I understand. If I do not understand at all, then I do not write it. Again, I'm telling you very simply, if I do not understand this thing, I will write this much only, that his baby's weight was 3.8 kgs. And he was having increased gastric reflex. So I will not write that word which I do not understand. I will not write about APGR, and I will write, and he was having increased gastric reflux. So my lines are all ready up to now. So when the baby was born, after 2 days, because he was born on 30th, 31st, then 1st. On second day of birth, after 2 days, weight was 3.5 kgs, so it decreased. He was having difficulty in breastfeeding, so mother was educated. Please listen to this recording again and again till the end. I'm telling you how to write. After 2 days, his weight decreased to 3.5 kgs. S भी डालना है, 3.5 kgs, as he was having difficulty in breastfeeding. Therefore, this is the connector. Therefore, the mother was educated regarding breastfeeding techniques. That is how you write this line. So please try and understand, it's not very difficult to write these things. So you use the connector. After 2 days, his weight decreased to 3.5 as he was having difficulty. You can say this thing. Or if you are not sure about connectors, then please do not use it. You can simply write over here and he was having difficulty in breathing. This is the safest one. This is the safest connector of the world, and he was having. Therefore, the mother was educated, but this is sure that he was having difficulty in breastfeeding. So the mother was educated regarding breastfeeding techniques. So this is how you write. Please try and understand. Try to make it as simple as you can for yourself. Okay. Now going on to the next page. So next page I understood. Mother was depressed due to feeding difficulty. So that was the problem on first. On second, after 3 days, so she was given counseling, she was educated, but next day also, the following day, mother was depressed due to the feeding difficulty. So again, advice was given regarding the supplementary bottle feed, because mother was unable to breastfeed. So that's why advice was given. So this line I would write again. Just please try to follow each line and write it. When you will listen to this recording, write side by side. Keep your pencil, keep your notebook with you, and try to write it side by side. The following day, the mother got depressed due to breastfeeding difficulties, due to feeding difficulty. So that you can write. So एडवाइस आपको सी वाला दिया, दैट इज नाउन, एडवाइस वाज गिवन, बिल्कुल ठीक दिया, बस वाज लगाना है. दैट इज द ओनली थिंग यू पुट इन ओईटी. एडवाइस वाज गिवन रिगार्डिंग सप्लीमेंट्री बॉटल फीडिंग. सो इससे पहले जो लाइन थी आफ्टर 2 days वाली, आफ्टर 2 days द मदर वेट ऑफ द बेबी या बेबीज वेट, बिकॉज इट्स अ लिविंग थिंग, सो वी से बेबीज वेट वाज 3.5 kgs and he was having feeding difficulties. This was the line earlier. So it happened on second and he was having feeding difficulty. So mother was educated. So the mother was educated regarding breastfeeding. So yesterday we told her to go for breastfeeding, but as the following day also she was having problem with the feeding difficulty. So we said you can go on the supplementary bottle feeding. Please try and understand. It's a story. It's a very simple story that mother, the weight was decreasing. So the mother was upset. So she was advised, educated regarding the breastfeeding. The next day again she was depressed. So we said, ma'am, it's better to give supplementary bottle feeding. On third, then don't keep on writing next day, following day. So you simply say on 3rd November. That is how you write simply. On 3rd November, both were discharged. That's it. Don't write about phototherapy. Why not to write about phototherapy? Because again, my topic is monitoring the weight of the baby, monitoring mother's health, weight of the baby, mother's health, and breastfeeding technique. So this is what is the topic. So I don't have to write these things. So community nurse ko, the only thing I want to tell community nurse is about feeding and depression. That's it. I don't have to tell anything else. Then last visit, that is today. So today, the patient presented. Simple, write it simple. Please make it very simple. Presented to emergency department. Sorry, the baby was presented. So baby अपने आप तो आया नहीं होगा. So the baby was presented. Sorry, the baby was presented to emergency department by mother with complaint of Toby complaint है, with complaint of increased gastric reflex and vomiting. Pain while feeding and wound side pain while baby latches on. This is mother complaint. Along with that, because now this is baby's problem, that with the complaint of increased gastric reflex and vomiting. So then along with that, the mother reported, या ऐसे कह सकते हो, बार-बार the mother आ रहा है, so it's better to write Mrs. Philip. So along with that, Mrs. Philip reported that she feels pain while feeding and wound side pain while the baby latches on. So this is one and the same thing, pain while feeding or when the baby latches on. So pain while feeding, bas, that is enough. On examination, mother wound was healing well, but nipples were found as red. So please write only negative part. The mother's wound was healing well. So I just am writing the main thing. On examination, the mother wound on examination. Other, if I have to write better, so I will say it was found that. Now this is better. So it was found that mother's wound was healing well. Okay, yeah. On examination, it was found that the mother's wound was healing well. If I do not write these 4 words, अगर मैं ये 4 words नहीं लिखता तो देखो कितना अजीब लगता है. On examination, the mother's wound was healing well. मतलब कुछ मिस हो गया. So on examination, it was found that the mother wound was healing well, but her nipples were found. That is passive. But that is the only thing you have to take care. Were found to be lacerated and painful. That is the only thing OET wants from you. That is the only thing. No hanky pankies, no over tries, nothing. Please try and understand this thing. So now simply write. If you're unable to find any connector therefore on the basis, then simply write. She was diagnosed with, simple. Don't make it complex. Please do not over try. When you are not finding the connector, it's better not to write anything. So you just have to believe yourself that it is not mandatory to write about connectors. So please understand this thing and do not take heavy pressure on yourself. I have to use the connector, because sometimes connectors are the reasons of getting not enough marks. So please, connectors are not important in every line. So she was diagnosed simply. Lacerated problem, she was diagnosed with breast nipple infection. Now, if you want to write anything better, then you can say, therefore, but again, this is today. So today on examination, it was found that her nipples she was feeling. So I have to write feels ki jagah, she was feeling pain. So I have to make everything pass till the time I'm using pass. So she feels ki jagah, Miss Philip reported that she was feeling pain. So I have corrected one more mistake of mine. Everything is fine, but she was diagnosed with nipple infection for which fluconazepam or for which medications were prescribed. Simple. for which few medications were prescribed. So this is, I'm telling to the community nurse that today what has happened is that baby was brought, and you can also make today everything present. So what you need to do for making it present tense, was ko has been, Mrs. Philip has reported that she is feeling pain on examination. Was को दोबारा passive voice को, was को has been. जब भी passive voice है, passive voice means has been third form, was की जगह has been found, that wound is healing well, सब कुछ present में आ जाएगा. There is no nipples, were की जगह have been, found to be lacerated, she has been diagnosed with breast neck for which few medications have been prescribed. So please सभी was were को has been have been में कर देना convert. That is the only thing. So सब कुछ present में आ गया. So that is not a problem by chance if you have written it in the past, क्योंकि इस situation में, in this situation, it is fine to write any tense. Few medications have been prescribed. So you say now, it would be greatly appreciated. अब मैं उसको last line, it would be greatly appreciated. अब nurse को कह रहा हूँ, it would be greatly appreciated. It would be greatly appreciated. So I've told everything. If you could monitor baby's health. This is logical now, the baby's growth. This is logical because I told that baby was losing weight, mother was not feeding well, she was feeling depression. So if you could monitor the baby's development. So I have already mentioned the point which is supporting it, because I already wrote in the second paragraph that he was losing weight, difficulty in breastfeeding. So if you could monitor the baby's development. Further, the mother needs weekly health checkup and should be, and weekly mother's health and post-operative activities with breastfeeding techniques, and should be assisted with post-operative activities regarding. So I changed the word because I won't like to use 2 times with. So the mother should be assisted with. When I do not know the right verb, so I say mother should be assisted with post-operative activities regarding breastfeeding techniques. So this is my whole letter. Now the only thing that is left is first paragraph, which you all should listen to, which you all should have in your mind. But that is what I'm telling you. First paragraph I normally make at the end. मतलब मन में जब मैं लेटर सोच रहा होता हूँ तो ये सब चीजें मैं पहले सोच चुका होता हूँ कि ये लाइन ऐसे लिखूंगा. When I am thinking in my mind, I make an image that all these things would be written like this. So now I can easily make the first paragraph because I know what exactly the whole letter is. Now I can make the first paragraph. This letter is being written. So I will write only things which are important. And my keywords while writing the purposes, baby development, breastfeeding for mother, breastfeeding techniques, and third was health, mother's health. So these are the 3 words. So I will be writing my discharge plan on these things. So this is what is the main thing. So ये मेरा main keywords है जिनके ऊपर मैं discharge plan लिखता हूँ. तो मेरे दिमाग में ये हमेशा रहते हैं जिसपे मैं first paragraph purpose हमेशा discharge plan के हिसाब से ही लिखते हैं. This letter is being written regarding Mrs. Philip. So I will first like about Mrs. Philip, who delivered a baby, who delivered baby, who delivered a baby 10 days ago. Simple. So I told this is the, again, first come first. So chronologically, the first thing that happened was Mrs. Philip delivered a baby 10 days ago. Now, coming to the point, breastfeeding, she's facing problem with breastfeeding technique, due to which she got depressed. Also, she got depressed. Her wound, her nipple is also lacerated. Yeah, she got depressed. She is having breast nipple infection as well. Again, please try and understand. Please try and understand. यहाँ पे also लगाना it's not good according to OET. OET do not encourage this. So whenever I want to use this also, I delete it from here and I say she is having as well. So as well fills the work for also. Also की जगह पे as well आ जाता है. So this is what I use. So I don't use also. So I say due to which she got depressed. She is having breast nipple infection as well. Besides, the baby has also lost some weight. So they both are being referred. So this is the main point why so I've told main thing according to this health and health may mental health is depressed, physical health is infection. So I've mentioned both the words. Besides, the baby has lost some weight, so they both are being referred to you for the follow up here. Yeah, for monitoring of their health and education regarding breastfeeding technique. This is my first paragraph. Rest of the paragraphs I have already written. So as I told you that in the second paragraph, you can say the baby was delivered via C-section, via LCSC, whatever was given, LSCS जो भी, and his weight was 3.8 kgs. After 2 days, his weight decreased to, this is the flow. I do not write extra thing, decreased to 3.5 kgs as the mother was facing difficulty in breastfeeding. So this is the flow of the letter. Now it will not take, even if I have to write again, it will not take even like 5 minutes. So weight decreased to itna. So the mother was having, as the mother was having difficulty. Therefore, she was educated regarding the breastfeeding techniques. This is all flow of the letter. So education to ऐसे वैसे has already been provided. So you can say post-operative activities. But again, even if you write this thing, that's all fine. Even if you just say monitoring of their health and education regarding, bilkul perfect. So this is how you write. Now everything will come in flow like we wrote earlier. So now we keep on writing the following day, simple, the thing I told you. So now this letter will go all in flow. So we have already prepared that letter. Now it's flow of the letter. Then next paragraph today. Then next paragraph, it would be greatly appreciated. This is how you structure the letter. So please understand, try to write it in the best possible way. And then you say, should you require further information, feel free to contact yours faithfully because the name is not given. Community nurse का नाम नहीं दिया है, so registered nurse. That's it. That's your letter. So please listen to this recording 2-3 times and try to learn the maximum. It's very easy to write. Totally, we have talked for 25 minutes only. So an OET letter can be finished in 25 minutes rather than 30 minutes or rather than 45 minutes. So you still have extra 20 minutes to revise your letter. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. Thank you.